Welcome to today's webinar, Affordable Housing and Recovery, Rural Resource Guide launch. Substance use disorder and opioid misuse have proliferated across the U.S. in the past decade. Rural America has been particularly impacted. Effectively addressing the opioid epidemic and supporting recovery includes a holistic community approach with an essential shared foundation, safe, stable, affordable housing. HAC is launching our new Rural Resource Guide, Affordable Housing and Recovery in Rural Communities, federally assisted housing opportunities for residents with substance use disorders and opioid use disorders. Today will be a discussion about the intersection of affordable housing and recovery and gain first access to the new Rural Resource Guide. Thank you to the U.S. Department of Housing and Urban Development's Rural Capacity Building Program for sponsoring today's event. It's my pleasure to introduce today's speakers. Up first is Natasha Moody. Natasha is a research associate at the Housing Assistance Council. Her research primarily focuses on equity in rural housing and community development. Before HAC, Natasha received her undergraduate degree from the University of Michigan and recently completed the Stevenson Center Applied Community Economic Development Graduate Fellowship at Illinois State University. She also served as an AmeriCorps member in Tampa, Florida, and a Teach for America Corps member in the Rio Grande Valley of Texas. It's also my pleasure to introduce Charlie Francis from the Council of State Governments Justice Center. Charles oversees the work at the intersection of housing, criminal justice, and behavioral health. He focuses on strategies for state and local partners to increase access to and availability of housing to reduce justice system involvement and facilitate successful reentry, as well as effective law enforcement and community response to homelessness. Previously, Charlie was the Assistant Director of Leased Housing at Rhode Island Housing and Director of Policy for the Massachusetts Department of Housing and Community Development. At the U.S. Department of Housing and Urban Development, he played a lead role in implementing the Rental Assistance Demonstration Program. Charlie holds a master's in public policy from the Heller School for Social Policy at Brandeis University and a BA from Hamilton College. Now I'd like to introduce our final speaker today, Lance George. Lance is the Director of Research and Information at the Housing Assistance Council. With more than 20 years of experience, Lance leads the organization's research, data, and information efforts. Lance works at the intersection of housing research and data to help Americans who have quality, safe homes understand and care about those who do not. Lance's research encompasses a wide array of issues and topics related to demographics and housing. Now I'm going to turn over the microphone to Lance George for opening remarks.
Hi, everyone. On behalf of the Housing Assistance Council, I'd like to thank you all for joining us today and welcome you to this important discussion on recovery, housing, and the launch of our new Rural Resource Guide. So we're looking forward to this discussion. I think there was an overview of the Housing Assistance Council in the introduction, and I often like to say that HAC is a national nonprofit organization that helps build homes and communities across rural America, with the operative word being help. We work with hundreds of local community-based entities and efforts, notably nonprofits, municipalities, tribal entities, and for-profit developers who are conducting a wide range of housing services in their communities. And you know what's best for your community. We just try to enable you through an array of resources and a suite of resources to achieve those goals. And I think that is emblematic of today's, the ethos and the effort around today's discussion. You also know that the issues that you deal with in your communities are continually evolving and changing, and the strategies to those communities are continually evolving and changing as well. And I think that's also very emblematic of this particular issue today. So I'm going to leave most of the comments up to the experts on this particular issue, but I'll make a few extemporaneous remarks around SUD and opioid use and the issue of housing, or the intersection of housing in rural communities. There's really been no community that's been spared from this, what I would call a scourge, candidly, over the past few years. And this particular issue in and of itself has evolved a lot as well. But these intersections, I think, are, they are, again, emblematic of the local response. And I'll have to say, almost from an anecdotal perspective, not from an anecdotal perspective, from the data, we know that this particular issue no one is spared on the basis of income or race or education or societal position or even age. And when I'm in rural communities, sometimes I take an informal poll around this issue and say, how many people in the room know someone, a close family member or a close friend who has been involved in these particular issues? And invariably, almost every hand in the room is raised, especially in rural communities. So again, that's an anecdote, but I think it's probably emblematic of the issue. And secondarily, we hear from experts in this field, notably in the public health space or in the justice community or in the drug community, that housing, or the lack thereof in many instances, is often one of the biggest barriers to recovery. But at the same time, it's also one of the largest opportunities, candidly. And that's what I really enjoy about today's discussion, is that we have an opportunity to talk about solutions and strategies for this particular issue, noting that, again, it is different in every community. So I, for one, am really looking forward to the discussion and learning with you. And we thank you all for taking time to participate with us, engage in this conversation, and help us provide solutions and strategies. And this is just the first effort in Hack's role. We're going to continue on, but this is kind of our opening salvo. But at this point, I really want to turn it over to our expert panel and first start with Charlie. Charlie's going to give us an overview of the issue and how it really intersects with housing. So thank you, Charlie.
Oh, thank you so much, Lance, for that great introduction, and really happy to be with you all here today. Again, excuse me, Charlie Francis from the Council of State Governments Justice Center. And here today, I really want to talk about. I'm really pleased that we're talking about really housing and homelessness in a rural context. I think that's something that we need to be talking so much more about on a national level. So I'm really pleased to be bringing the focus there. And in particular, looking at people, who are in recovery from, substance abuse disorders, people who've and in particular, how that overlaps with involvement with the criminal justice system. So that's kind of what I'm going to focus on today. How those things intersect, particularly in rural communities. How the dynamics, in some ways they're the same that we see everywhere, but in a lot of ways they are different. How housing providers can really be part of making a difference. And in particular, we're seeing a lot of exciting moves at the federal level to kind of set the table for making those changes, which I think really sets the stage for this resource guide that's going to be launched today, which really provides a good foundation for really those of you who are working in the field to really understand what's out there in terms of rules and regulations in the housing landscape. So really, in terms of what is driving homelessness nationally, some of the big picture forces are the same in smaller and larger communities, but rural areas and smaller communities, will often face particular challenges to overcoming those issues. And, a lot of those, I don't think are going to be news to folks on this call. You may not have access to as many services or service providers or transportation or employment opportunities. And also, there may not be as much federal or state investment in housing resources. Another thing, obviously, I come from the Council of State Governments Justice Center, and so we look a lot at rates of incarceration. They're typically pretty similar, whether we're looking at rural, suburban, or urban areas, but, looking at some of the data that we have been seeing some increases in certain rural areas. And one trend we have noticed that people in rural areas are somewhat more likely to have people who are experiencing homelessness in rural areas, in some cases are a bit more likely to have been involved with the justice system in the past than people who are experiencing homelessness in urban areas. So it just, all that is to say is, it's this overlap in populations is important everywhere, but I think it's a particular focus, we're looking at our rural communities. And, it just in general, people experiencing homelessness and people who have contact with the justice system, they overlap with a lot of other populations, and it can really exacerbate the existing racial inequities that we know are, big problems in both the housing, health, and the behavioral health care systems. And finally, just having fewer service providers available just means fewer opportunities to provide the supports needed to reduce and prevent involvement with the justice system. So, housing providers can really play such a key role in creating these supports, creating these connections, and really bridging these gaps. However, traditionally, there's been a whole host of federal, state, and local laws, and in particular regulations at the housing provider level that have made these connections difficult. Nationally, there are more than 1,000 different known state laws and regulations that affect or restrict housing access for people with criminal records. In terms of federally funded housing, HUD has a few basic requirements. I know the resource guide goes into this, that housing authorities and other federally funded providers need to stick to. But for the most part, actually, and a lot of people don't know this, the federal government actually allows some pretty wide local discretion to local providers in setting the rules in terms of what their screening criteria are, in terms of people's criminal histories. And that includes people with, drug and substance related, past convictions or other criminal records. And HUD in particular has really, in recent years, made a lot of moves in this area to try to make things easier. They put out some guidance in 2016 to housing authorities and other housing providers, making it clear that you cannot use arrest records to deny people housing. And that is a particularly salient issue, for people who have struggled with substance abuse issues. A lot of people out there who may have been arrested but never convicted. That same guidance also, does a lot of other things, including showing that, housing providers don't have to adopt one-strike policies or evict people as a result of, a criminal record, So that was kind of the foundation that HUD laid back in 2016. And more recently, just last year, the Secretary of HUD, Marcia Fudge, instructed every HUD office to review every HUD program and propose changes to look at all relevant regulations and guidance documents in a comprehensive effort to really reduce barriers to participation for people with criminal records. So basically looking at regulations around public housing choice vouchers, Section 8, all of the HUD-funded programs, and seeing where HUD could reduce barriers within its own programs to make it easier to admit and house people who've been involved with the justice system. And that guidance also really encourages HUD-funded providers to prioritize people who've been involved with the justice system for housing. And it also complements some other recent guidance by HUD. For example, as part of the American Rescue Plan, the large package of funding that was put out to help recover from the COVID-19 pandemic, one of the big streams of funding was the Emergency Housing Voucher Program, a special allocation of housing choice vouchers, focused towards people experiencing or at risk of homelessness. HUD made it a specific point, that communities can and should be focusing a subset on these vouchers to people with justice involvement. And some continuums of care, and for those folks who don't know what a continuum of care is, basically it's a locally or regionally constituted planning body that takes all of the HUD homeless assistance funding for a given geographic area and allocates it among different providers. Certain continuums of care, including rural communities such as the Kings Tulare Homeless Alliance in California, are actually doing just that and allocating some of their vouchers towards people who've been involved with the justice system. HUD is also, taking steps within this continuum of care program specifically to address rural homelessness issues. They put out a special notice of funding opportunity about a couple months back with over $50 billion specifically to address rural and unsheltered homelessness, and also allocated several thousand vouchers for that. So the point is, there's a lot of movement on the federal level to both try to reduce barriers to housing for people with criminal records and also to increase the amount of resources That's if you take away one thing from everything I'm saying, that's probably the thing you want to remember. So it's really a great time to be working with your local housing providers, to kind of see what you can do, because that's really the way that the field is moving. And also, also on the federal level, the United States Interagency Council on Homelessness just reduced a new federal strategic plan to prevent and end homelessness. And it really places a heavy emphasis on the fact that people with current or past criminal justice system involvement face a lot of housing discrimination and stigma, and places a lot of focus on decriminalizing homelessness in local communities, and a lot of efforts on how federal partners and local partners are coordinating. But the reality is, on the ground, many local housing providers are still instituting more restrictive bans than HUD requires or even is recommending through this guidance. Many are not, but many still are. The field is shifting, but slowly. And so that's why putting out resources such as the Rural Resource Guide that's going to be launched today is such an important foundation, because it's really important just to know what the regulatory landscape is, and what really the guidelines are when you're looking to find different housing resources for people who are in recovery. And then finally, just another thing I wanted to talk about is that, in addition to understanding kind of the regulatory landscape, who your local housing providers are, just to provide a foundation for successful reentry and successful housing for people who've been involved with the justice system, it's really important for people to work together across systems. A lot of times people from the affordable housing system and the criminal justice system and the behavioral healthcare system, it's like they're speaking different languages. And that's nobody's fault. I mean, everyone is very good at their job, is very busy, is funded by different people. But, really investing the time up front to kind of sit at each other's different planning meetings, whether it's a continuum of care board meeting, a criminal justice coordinating council, all of these sort of successful housing programs we've seen that dedicate housing resources like these emergency housing vouchers to people that are involved with the justice system, it's almost always based on these sort of long-term relationships that have been built by these leaders across different systems. And so we kind of have this 4-step approach that we often suggest to communities that we call action points. Collaborate, assess, connect, and expand. And I have a brief on this that I'll share in the chat after this. But basically, to put it simply, you build that collaboration that I was just talking about. Get the systems talking to each other. Make sure that you have a way to assess what people's housing needs are. Particularly say that you have folks that might just be coming out of jail. Who is at risk of homelessness? What are their housing needs? Do they have somewhere to go? You need to have a way to know that. And then connect. Do you have a system to connect people with housing? Do they have somewhere to go when they're getting out? Do they know who the housing providers are in the county and have a way to get there? And then finally expand, because we know, particularly in rural communities, there's never enough housing supply. So while you're working to connect people with the housing that's out there, at the same time, you need to really be working to expand the supply. And, in rural communities have really found some unique ways to do this. In Appalachian, Ohio, I think it was Athens County, Ohio, the local behavioral health board partnered with the city of Athens to set aside, it was a small number of units, 10 units for people with serious mental illness leaving jail. But they did that again because of this foundation of ongoing collaboration. They were sitting together in the same meetings, realizing this was a need. And so they were able to, set aside a small amount of resources and get that direct assessment of needs and connection to those housing resources. Those are the kind of partnerships that really make an impact at the community level. And finally, the most effective housing programs follow what we call as a housing first approach, which I'm guessing at least some of you have probably heard of before, maybe many of you. which really prioritizes placing people in stable housing without preconditions for meeting other goals, such as treatment engagement, employment, and more. Now, housing first, it's not a cure-all for everything. Sometimes, more of a recovery-focused environment is the right environment in certain cases, particularly people who choose that recovery as part of their treatment plan, their conditions of release. But when you're looking at permanent housing, housing first definitely, is the most evidence-based way to go. And there's just a number of studies, including from rural communities, showing that really the efficacy that these type of permanent supportive housing programs really work across urban, suburban, and rural communities, which is great because it's not always the case that something that would work in a large urban community will work in a small rural community. But the housing first approach, including having small housing units in different parts of a county, with mobile services being shared across a geographic area. There is evidence that approach actually works, to reduce returns to jail, to keep people housed, and to increase, I know, which is really important to this group, to increase engagement with services and treatment. So finally, I think, connections to supportive housing, it's just essential both to reduce involvement with the justice system, to reduce homelessness, and to promote recovery. You're really kind of doing all of these things at once. The federal part, we're at a really opportune moment right now where federal partners are setting the table. There is actually a lot of great local work going on. I've named just like a couple quick examples. I could certainly share a lot more in the Q&A, or if people want to follow up with me. But there is so much more opportunity to work with your local housing partners, to do so much more to really create housing opportunities for folks that need them the most. And I'm so happy to be here today, for the unveiling of this great resource that I think is going to really create a good foundation to do that work. So thank you so much for having me here, and I'll hand things back to Natasha to unveil the guide.
Thank you, Charlie. Hello, everyone. Charlie, thank you so much for those opening remarks and sharing more about the initiatives and changes taking place in federal programs. As you mentioned, we're grateful as part of HACT to be entering this conversation and this work in this time. And thank you so much for sharing those resources and examples for us to look at to model work after. So thank you so much for that. So hello, everyone. My name is Natasha, and I will be discussing the guide today. So just getting set up here, excuse me for a moment. And so just to start off our conversation, I want to mention that we will have some time for questions and answers at the end. So if you have some questions, you can feel free to drop those in the chat, and we'll answer as many as we can at the end of the session. And so thanks again for joining us today for this new rural resource guide. To get started, I'd like to just discuss some statistics that were recently released around substance use disorders and the opioid epidemic. And so in 2021, the 2021 National Survey on Drug Use and Health was just released. And in 2021, 4.6 million people were diagnosed with substance use disorders. And about 6.7 million of those diagnoses and folks diagnosed were living in rural areas. And 94% of people who were diagnosed with substance use disorders did not receive treatment in 2021. And also, the CDC provisional drug overdose death counts surpassed 100,000 in a one-year period for the first time between May 2020 and May 2021. And the most recent data reported from August 2021 to August 2022, there were over 101,000 overdose deaths recorded. And so, as Charlie mentioned, Lance mentioned, and I'm sure many folks on the call are familiar with, that the overdose epidemic, substance use disorders really are affecting many communities across the country, and particularly in rural areas. And addressing the overdose crisis and supporting recovery involves collaboration across many sectors. And some of those sectors include the mental and behavioral health space, public health, policy, criminal justice space, and many practitioners and experts. There are many folks who have and will continue to advocate and provide much needed services and support to residents in recovery. And many rural residents lack access to treatment options and support services for recovery, including consistent, safe, and affordable housing. So the Housing Assistance Council, we continue to hear from practitioners and experts that safe and affordable housing was essential to supporting recovery. But there were some questions around access to federally subsidized housing. So we compiled this affordable housing and recovery in rural communities, federally assisted housing opportunities for residents with substance use disorders and opioid use disorder guide to serve as a resource to provide a one-stop overview of the federal regulations related to this topic. So the guide discusses regulations specifically related to providing federally subsidized housing to applicants with a history of substance use disorders, opioid use disorders, or alcohol addiction. The guide also discusses providing housing to applicants in recovery, applicants with drug-related criminal history, and applicants with disabilities related to substance use disorders, opioid use disorders, or prior addictions. The resource guide does not provide an overview of all the program regulations and is not meant to be a guide for legal advice. It doesn't include all possible relevant guidance and regulations, and also state and local laws and policies may also have additional regulations on top of those from the federal programs, as Charlie mentioned earlier. And so there are also regulations from the Fair Housing Act that may be relevant, and the intent of this guide is to provide a clear and specific overview of the federal regulations related to housing folks with a history of substance use disorders and the implications of their histories with substance use disorders. And so the aim is just to be a resource for those considering applicants or looking for housing through federally supported housing programs. So I'd like to just give a sneak preview of the guide, and discuss the format a bit. So the guide provides a summary of various federally subsidized housing programs and provides the regulations regarding those programs. And so each section contains a bit of a summary discussing our findings in the regulations, and it also includes links to information about the overall program. As I mentioned, this guide doesn't go through all of the regulations for the programs, and so we anticipate that folks engaging with the guide may have different levels of experience with different programs, and so there are links to learn more about the general regulations for each program. Each program highlighted includes excerpts and summaries from the federal code, and this includes applicable terms and definitions and the regulations. The definition regulations are linked within the document straight to the federal code for easy access. So if you'd like to see the code within the federal code, the links are there as well for easy access and to see any additional information. And so for the purpose of this presentation, I'll discuss a few observations in the federal regulations related to providing housing for residents with a history of substance use disorders. So first, I'll discuss some of the programs from the U.S. Department of Housing and Urban Development, from HUD, and highlight some of the programs listed here. So HUD's Housing Choice Voucher Program provides local public housing agencies funding to provide rental subsidies to eligible families. This program has two stages of approval for families seeking rental assistance. There's approval from the Public Housing Agency or the authority, and there's also from the owner and the landlords. And I'll discuss both of those sections of screening that may take place. So the PHA must create an administrative plan which outlines the local policies for the program. This administrative plan includes applicant screening, selection, and denial process, and it must outline the procedure for admission and denial of any applications. And this includes households with members with a history of substance use disorder. The PHA may deny an application for 3 years if any household member was evicted from federally assisted housing due to drug-related criminal activity on federally subsidized housing properties. And so there is that denial of application if someone has been convicted for using or having drug-related criminal activity on a federally subsidized housing property. If the evicted household member completes an approved drug rehabilitation program, or that household member is no longer an applicant within that household, then that admission may be considered. However, If there's an applicant that's been convicted of manufacturing methamphetamines on the grounds of federally assisted housing, then they must have a permanent ban from federally subsidized housing. So after the PHA may provide the voucher, there's a second set of screening that may come from landlords, which are referred to as owners in the regulation. And so owners are also given discretion for screening a bit of leeway around screening applications and protecting this health, safety, and right for peaceful enjoyment for all tenants. When screening applications with a history of drug use or drug-related criminal convictions, the landlord can consider whether or not the applicant is currently in recovery, or what their current drug use may be, or what their history of drug-related criminal activity may be. The landlord cannot, as mentioned, cannot use criminal activity as the only reason to deny an application. They may also consider rehabilitation programs, or whether or not the applicant can demonstrate they're no longer involved in drug use. And so having a history of substance use disorders or having drug-related criminal activity is not a sole reason that an applicant can be denied from the Housing Choice Voucher Program. Another program I'd like to discuss is the Public Housing Program. So there's some overlaps in the regulations with the Housing Choice Voucher Program. Public housing authorities have the authority to screen applications, access applicant records, including their criminal records, and interviews with prior landlords or their personnel. They are able to do this to determine if an applicant meets the standard of admission that they've set for their properties and programs. But for applicants with a history of drug use or alcohol misuse or drug-related criminal activity, the Public Housing Authority may set their standard of admission and see if the applicant is suitable for admission to the property. Criminal activity cannot be a sole reason to deny tenancy, but the Public Housing Authority may set admissions requirements and follow those. Similarly to the Housing Choice Voucher Program, any applicant that's been convicted of manufacturing methamphetamines on federally subsidized housing properties will not be allowed to have access to this program as well. But again, similarly, having a history of substance use disorder is not a sole reason that an applicant should be denied from public housing programs. I'd also like to discuss the Home Investment Partnership Program, Tenant-Based Rental Assistance Program. And so in this program, there's some flexibility for participating jurisdictions to meet the needs of their communities. So funding for this program is distributed to state and local governments, and those are called participating jurisdictions in the regulations. These state and local governments can demonstrate an unmet need in a community and may develop specialized programs eligibility in a consolidated plan. So once a consolidated plan is created and demonstrating an unmet need in a community, there may be specialized programs to provide housing for folks with disabilities, which may include residents with a history of substance use and opioid use disorders. So there is flexibility within this program to provide housing. And as I mentioned, throughout the guide, we highlight housing for folks with disabilities due to a history of substance use and opioid use disorders. We mention folks that may have criminal histories due to drug-related charges, and a variety of ways that substance use disorders may affect a household. So for this particular program, states and local jurisdictions may use this program to create specialized housing to provide housing for households with a history of substance use disorders. I'd also like to highlight the Recovery Housing Program. This is one of the newer programs with specific grantees. And so grantees for this program giving flexibility to develop recovery housing program and an action plan and determine their own terms for eligibility. The definitions for eligibility cannot exclude individuals with specific types of substance use issues. It needs to be open to folks in recovery from substance use disorders. And so this program's a bit newer, and there are specific grantees for this program, but this program is designed to provide recovery housing from substance use disorders for up to 2 years. Also, I'd like to highlight the supportive housing program. This provides housing and services to households experiencing or transitioning out of homelessness. Tenants or recipients of services through the supportive housing program must meet the definition of experiencing homelessness. The program can include services for persons with disabilities, including impairments caused by alcohol or drug use. Disabilities and experiences with homelessness must be verified with specific forms of documentation. In the Shelter Plus Care program, this provides permanent housing in connection with supportive services for persons with disabilities who are also experiencing homelessness. This program's target population includes households affected by chronic problems with alcohol, drug use, or both, and any issues with mental illnesses or being affected by mental illnesses. To be eligible for assistance through the Shelter Plus Care program, persons must be very low income, and they must meet the definition from HUD of the homeless status and having a disability, and that documentation must be maintained as well for that program. And also from HUD, I like to highlight the Section 811 program, which provides housing and services for very low and low-income persons with disabilities. Subsidized rental housing can be provided with supportive services through this program. Persons with a history of drug addiction or alcoholism may qualify for provisions if they also have been diagnosed with HIV or meet HUD's definition of a person with disabilities. So having a history of substance use disorder or other addictions will not be a sole qualification for this program, but persons with a history of substance use disorders, who also either have HIV or meet the definition of having a disability, may qualify for this program. And so in our guide, we also included programs, the low-income housing tax credit program and the single-family housing loans and grants from USDA and multi-family housing loan programs. I want to mention that for all the programs similar to the HUD programs, we're solely highlighting the regulations that are specific to providing housing to households affected by substance use disorders. So within the guide, we've included links to learn more about each of these programs in more capacity if you'd like to. To start with the low-income housing tax credit program, this is a very nuanced and program and differs greatly from HUD programs. And so to highlight the regulations around potentially providing housing for residents affected by substance use disorder, state low-income housing tax credit allocation agencies are required to create what's called a qualified action plan. This outlines the selection criteria for the projects which will be awarded these tax credits. These qualified action plans may include projects focused on populations with special housing needs. And the regulations state that there are allowances for the inclusion of supportive services, which are, quote, designed to enable residents of residential properties to remain independent and avoid placement in hospitals, nursing homes, or intermediate care facilities. And so this is a very simplified overview of this program. And if you'd like to learn more about the program, there are links within there, but there are some regulations that highlight that specialized housing is permissible within the program. And then lastly, but not least, we like to highlight some of the USDA programs. So starting with the Section 502 and 504 loans, though they are different programs and they're administered differently, there are some similarities within the regulations regarding households with a history of substance use disorder. The regulations do not explicitly state criteria around acceptance of applicants with a history of substance use disorders, but within reading the regulations, what we noticed is that some of the financial requirements for this program may pose as an additional barrier for applicants depending on their stages of recovery and prior effects in their livelihood from their history of substance use disorders. And so any applicants with significant financial delinquency within the last 36 months may be ineligible for these programs. And so even though there's not criteria specifically outlining whether or not applicants with a history of substance use disorders can be admitted or not, there may be additional barriers based on how the substance use disorder affected the household. Then I would also like to discuss the Section 515 mortgage program. This is for residents with very low or moderate income families. And so persons with disabilities are eligible for services in congregate homes or group homes. and definition of disability for this program in the regulation includes individuals with physical or mental impairments due to prior drug addiction. And so, however, applicants with addiction caused by current use of an illegal use of a controlled substance are not eligible for services through this program. So someone will need to be in recovery, but if they're in recovery and potentially have disabilities due to a history of substance use disorders or substance misuse, they may be eligible for this program. And so I spoke through many programs quickly there and just gave some quick highlights on the overview. However, the guide does include this information and a lot more. And I just want to highlight a few of the findings and pull specific regulations that we saw that discussed how some of these programs may be used to provide housing for residents with a history of substance use disorders. And so I wanted to share a few observations that we noticed while putting this guide together. First, we want to just highlight through this guide that residents in recovery and residents with a history of substance use disorders may be eligible for different federally subsidized housing programs, or different federally subsidized housing programs may be used to provide specific supportive housing or supportive programs for residents with a history of substance use disorder, whether that includes with disability or a history of, or folks who've been justice involved. There are regulations that allow for provision of housing. However, each of the programs have additional requirements and considerations for eligibility. So for some programs, the locality creates those extra provisions. Sometimes it's the landlord or the owner, the state. So within your locality, each locality may have different additional eligibility requirements that may lead to residents being ineligible. We also just wanted to acknowledge that given the high demand for affordable housing, particularly in rural communities across the country, eligibility does not guarantee acceptance to any of these programs. And so we want to acknowledge that. We also want to acknowledge that the guide discusses the regulations, but how these programs operate, their capacities, and other variables vary across localities. State housing departments or agencies, local public housing authorities, other local housing and other local housing organizations can provide information about your specific regions. And so, although we are able to see within the regulations that it's possible to provide federally subsidized housing to residents with a history of substance use disorders, there are other factors we'd like to acknowledge that may lead to additional barriers. And so we would like to ask if there are any professionals or residents in attending right now that know about any localities, states, or local public housing authorities that are exemplary and have very innovative ways of approaching providing housing to residents with a history of substance use disorders. We would love to hear about them in the chat if any come to mind. We'd love to learn more about how and share together about how any public housing authorities, housing organizations, or localities are addressing this. But we just wanted to put this guide together to be a place to highlight and say that the regulations show that residents with a history of substance use disorders can be eligible for federally subsidized housing, and that is not necessarily a barrier to accessing affordable housing. And so would like to thank you for your attention during this presentation and for joining us today. We do have time for some questions. You can feel free to put those in the chat, or you can feel free to use the raise hand function at the top of the Teams window. There should be a reactions. There's a raise hand function there if you'd like to ask your question verbally, but we're open to question and comments at this time. Thank you.
Thank you, Natasha and Charlie. It was extremely valuable and rich information, and we really appreciate you providing this service and providing more insights into this particular issue. I would echo what we've said throughout. If you could please paste your questions into the chat, and we'll try to get to them, and as many of them as possible. I'll start out with a couple of issues. First of which is we had a really good question on can I access the guide and how do I access the guide? So yes, of course. That's why we convened this discussion. We want you to access it and use it. We placed a link to the guide itself in the chat, and you can also access it at any time at HAC's website, www.ruralhome.org. So those were, that's one kind of, just want to highlight that you have access to the guide. And I would also say, I think Natasha would agree that, and also as well as Charlie's remarks, that we really only scratched the surface. And that's why we're making, we have limited time in this discussion. And these are, some of these are relatively in-depth and detailed programs and have a lot of information. So we really only scratch the surface. So we do encourage you to actually access and download the resource guide itself. So I'm going to start out with an initial question that we had. I'll posit it to both Natasha and Charlie, but possibly this one looks like it's more for Natasha. How do I know which program to recommend to an applicant with a history of SUD? Because you talk about different programs in there, Natasha.
Thank you. I will start off, and Charlie, if anything to add, please feel free to jump in. So that's a great question. I think for one, as I mentioned, there are different requirements outside of an applicant's history of substance use disorder, opioid use disorder. Some programs require that the applicant have a documented and diagnosed disability or have a history of experiencing homelessness. And so it depends on the other factors and their eligibility to the program. I think that the best way to determine which program an applicant may be best suited for is to first see which programs are available in your locality, and which is the state funding for which ones are easily accessible, but also seeing which other requirements the applicant may or may not meet for each of the programs.
Thank you, Natasha. I'm going to posit the next question, which is also an inquiry that I had to Charlie, particularly related. This is, you noted, and I think this to me is an important dynamic, that oftentimes housers do what they do really well, right? And the behavioral health community does what it does really well. And the justice community does what it does really well. But we're all somewhat, to overuse that phrase, kind of in our silos. And I think you provided some good examples of what would be some cross-collaborative efforts from those communities. We're all busy with what we're doing. And we probably need more holistic approaches in general, but particularly for this issue. So if you had one, I think sometimes we're trying to bridge some of these communities, Charlie. If you had one suggestion for a houser, how to learn more about this in an applied sense, and vice versa, maybe someone from the SUD or the behavioral health community to learn more about housing, maybe what would one of those one good, just one action be in addition to many?
Yeah, absolutely. I think that's so important. I think for anyone, anyone from who's looking to learn more about housing, I think that the number one thing to do is to, become involved with your local continuum of care. Especially if you can find a way to join the continuum of care board. Because that is the group that is meeting often monthly to kind of look at the needs of everybody who's experiencing or at risk of homelessness in the community, including, and typically there's a heavy focus on folks, who are in recovery, in this population, or at least there should be. And if there isn't, there's a big opportunity to really bring that voice to the table, particularly as sort of the yearly cycle comes around of deciding how the HUD funding gets allocated to new projects, and kind of how the COC standards are written, to decide who gets prioritized when a housing slot becomes available. So I'd say the number one thing you can do to learn more about housing and the housing system is to become involved with the COC. I mean, there's other ways too, but if you take one thing away, I think that's probably that. And then in terms of, for housers to learn more about other systems, I would say it's most important to really, to understand that, a lot of times when if you're a housing authority, say, for example, you're dealing with such limited resources, and sometimes it feels like everyone's getting in line, for the same, 10 vouchers. But really, looking at the data in your community, getting to know other agencies, the more you can develop an understanding that, and it really comes down to data, because whenever we look at data, whether it's in a state or a community, a lot of the same people that you keep seeing coming in contact with the criminal justice system are the same people who are coming in contact with the behavioral health system, the same people in contact with the emergency housing system. The more that you can understand who are those people, the more that you can really sort of target resources and be more efficient, and also understand kind of these overlapping needs and put these different services from different sectors together to meet them.
Great, thank you, Charlie. There's a question in in the chat that's, I think, specific possibly to what we talked about a lot today was regulations, but that might be related to new policies. But the question is, there are many landlords that will not accept TBRA, which are tenant-based vouchers, or Section 8 vouchers. Is anything being done to make it illegal to discriminate on how a persons get rents paid?
I mean, I can start with that one. That tends to be a state by state and locality by locality question. There are a number of states, cities, and counties that have what are called source of income discrimination ordinances that do make that illegal. But right now it's a real patchwork where some places allow it and some places don't. Like my home state of Rhode Island, for example, we just passed this maybe a year or two ago. It took many years of sort of coalition building. But unfortunately, it's something that it's not protected under the Federal Fair Housing Act. I mean, I'm not sure if we will see some federal action, eventually. I wouldn't rule it out, but for now, it's really a state and local advocacy effort. And so it's really a state by state question, but definitely I know that if you live in a place where that's not in case, odds are there are probably some people working on it, and I encourage you to get involved with that campaign.
Thank you, John. Another question, trying to get to as many of them as possible. How often do you foresee, and I think this is really maybe geared or targeted to Natasha, because I know that she probably has a good answer for this, but how often do you foresee having another webinar related to this topic? Does it basically depend on the updates to the recovery housing program?
Thank you. So we actually, sneak preview, because we're going to mention this later, but we are having another webinar February 15th. So this is the unofficial save the date, where we're inviting professionals from various sectors, the criminal justice space, behavioral mental health, housing, to have a cross-collaborative discussion around how different, very similar to what Charlie has been discussing about how folks can work together to find innovative solutions, because as I'm sure many in the call are aware, as one of our previous questions noted, there are various barriers to overcome to really providing affordable housing to the capacity that's needed, and it will involve many sectors, including, we just mentioned, like policy, and there needs to be legislation changes and things of that nature. So February 15th, we will have another webinar. I will say that at this point, we are not particularly solely focusing on the recovery housing program per se, but HAC looks forward to being involved in this, but our very next webinar is February 15th.
Thank you, Natasha. I'm seeing several questions and comments on how helpful this was, and a lot of compliments. So, and also just offers to connect. So I think we are open to continue this discussion. This is a relatively new effort at HAC, although I think we've had strains of this in our work for years. But as just to follow up on what Natasha said, we are kicking off a more comprehensive approach to this particular issue and learning. As I noted earlier, I think this issue has evolved dramatically, probably for the worse over the past few years, and it will continue to evolve. And I think we'll continue to update and continue this process. So, but I also want to reiterate that I think we are open to making connections on this particular issue. So thank you for that question. There was just another question that I'll note, and I might ask Natasha to elaborate, because we spent time on HUD, USDA, and the low-income housing tax credit, which is administered through the IRS. But there was a question, someone noted that they do use USDA Section 502, 504, and many of our stakeholders do. That's an important resource. Correct me if I'm wrong, Natasha. This was more of a comment, but when I reviewed the guide, it seemed like many of the criteria were more explicit along the HUD programs, and they were less, I wouldn't say clear, but there were less guidance in the USDA. And I'm just curious if you saw that as well in your analysis.
Thanks, Lance. Yes, that's what stood out to us in the creation of the guide was there was less explicit guidance around specifically providing funding to households affected by substance use disorder. Most of the regulations were tied to the financial requirements of the applicants. So the most notable portion, I think that what we thought was most related was the applicants with significant financial delinquency within 36 months may be ineligible for the program. And so depending on how the substance use disorders or other forms of addiction may have affected that household, and which may have some financial implications that may have led to some form of financial delinquency. Everyone's experience is different, but if the household's affected by those financial, any kind of financial delinquency or hardship due to substance use disorders, they may be ineligible for the program that way. But most of the regulations around those requirements, there was very little explicitly discussing specifically substance use disorders.
Great, thank you, Natasha. I guess that could be good and bad in some respects, right? But we have limited time, so I'm going to ask one more question. Again, I think there are a lot of comments in the chat where we'll reach back out to people who want to connect. So we appreciate your intersection and your interaction today. But I'm going to ask one more quick question to both open it up to Natasha and Charlie, which I think probably is at the heart of why most people are on this call. And it's not an easy question, but I'm going to throw it out there anyway. And it really gets to sometimes the individual person that you might be trying to assist. And says, how can I help a resident with a history of SUD meet eligibility for a housing program? And I know it's somewhat wide, open-ended question, but wanted to throw that at you, maybe your best recommendation.
I can start, and I'll try to be quick with our time, but I think based on a different discussion, comments, and Charlie's remarks, it really depends on the locality. So I think the first place to start would be at the local public housing authority or on the state level, seeing which programs are available. If there are programs like we just mentioned, Section 502 and 504 around the financial delinquency, maybe it's looking at the other requirements around the programs and seeing how they can be assisted that way. But I think definitely starting on the local level is the best approach.
I completely agree with that, and I would add, look the most at supportive housing programs, and if that's not kind of supportive / recovery housing programs, and if that's not what's immediately available, if you can connect the person, with the case manager, with the behavioral health agency, if they are coming to whether it's subsidized housing or even just a private landlord, if they're coming with some sort of supportive services attached, or even someone that they can call, like so often a housing provider just needs to know that they have that peace of mind that there's someone they can call if something goes wrong. That will when they do have that discretion, that will so often create that peace of mind and really make the difference.
Great, thank you both. I think we're coming up on close on time. I want to first thank our presenters today. Just a really rich discussion, and I think it was a value to everyone on the call. And we also want to thank you who participated. This is, again, a holistic approach, and we appreciate your interest. We had a really good response to this discussion. Unfortunately, that's maybe not great, in that shows the prevalence of this issue, but also we are committed at the Housing Assistance Council to paying serious attention and being intentional about this particular issue. So first, let me re-thank Natasha and Charlie, and also let you know just to access the guide, but also stay abreast of our website and what we're doing in this space. But because we are making a concerted effort on this particular, issue, and there'll be more to come. So we thank you all for stopping by today, and we will continue the discussion with those who have reached out. That's what we're here for. So thank you all.
Thank you.
Thank you, everybody. Great to be with you all today.